is Ms. Audrey Quartey. She's a senior manager of provider relations at the PAN Foundation. In her current role, she works very closely with the Vice President of Medical Affairs to develop and implement PAN's provider outreach strategy. And she has over 10 years experience in the healthcare industry, focusing on insurance coverage, reimbursement, and access to care plans. So Audrey, the floor is yours.
Thank you so much, Dawn. And thank you, everyone. I'm really excited to be here today. I know a lot is going on in the world, especially given everything that is happening with COVID-19. So I'm really glad that you were able to take the time to join us for this segment of connecting underinsured patients with the treatment that they need at the PAN Foundation. So as Dawn said, my name is Audrey. I am the Senior Manager of Provider Relations at PAN. And so before I begin, let me just go ahead and share my screen with you so that you can see my slides. Bear with me 1 second while I do that. Okay, so let me try to do that again. Let me try to share my screen again. Are you able to see my screen now?
It's doing. Good job. Done.
Great. All right. So let me go ahead. So today I'm going to walk you through what we do, why we do it, and how you can apply and receive assistance with the PAN Foundation. I know I'm going to provide you with a lot of information and you may not be able to grab all of it, but I will go ahead and provide my contact information towards the end so that you'll be able to access or give me a call if you need to. And so with that, let's go ahead and get started. First, I'm going to tell you why copay assistance is important. So as you already know, access to medically necessary treatment is critical for successful patient outcomes. However, this access is sometimes blocked by high cost sharing, which can negatively impact both the quality of life and the course of a disease. High cost sharing refers to healthcare expenses that are not covered by the patient's insurance and must be paid out of pocket by the patient. So these out-of-pocket costs comes in the form of deductibles, co-pays, and co-insurance, and I'm sure you're all too familiar with it. Patients who have insurance but are unable to afford the out-of-pocket costs associated with the treatment are considered underinsured. So a recent study by Fabry Family Foundation found that on average, Medicare beneficiaries spend 41% of their Social Security payments on out-of-pocket cost, and that amount just will rise to about 50% by the year 2030. And I can't even imagine already almost 50% of the Social Security income is being spent on out-of-pocket costs. That's quite a bit per year. Also, between 25 and 30 million people were underinsured in the United States as of 2019. And the underinsured population is sure to grow even bigger this year, especially given COVID-19, creating an even bigger gap for the underinsured population. So for many patients with chronic, rare, or life-threatening diseases, this cost of care can add up very quickly, putting many patients in this underinsured category. In 2019, Sugar Research conducted a survey to assess patient satisfaction and the perception of service provided by PAN among patients receiving financial assistance. After receiving assistance from PAN, an estimated 94% of patients responded that support from PAN made them more likely to take their medications as prescribed and had a positive impact on their families. Also, 92% reported that support from PAN improved their quality of life and decreased stress for the whole family, showing a true need for support from all patient assistance foundations for the underinsured population. So the Patient Access Network Foundation, we believe that out-of-pocket cost should not prevent anyone from obtaining medically necessary treatment. So today I am going to tell you about how PAN can help remove the financial barriers and alleviate high out-of-pocket cost for the underinsured. So the Patient Access Network Foundation is a nonprofit organization, and we're dedicated to helping federally and commercially insured patients with their out-of-pocket expenses for their prescribed medication. Since its founding in 2004, PAN has helped nearly 1 million underinsured patients with over $3 billion in financial assistance. So we have 3 types of assistance program. Our first program is our medication assistance program. This program assists patients to pay their co-pays, deductibles, and co-insurance. Our second program is our health insurance premium assistance program, and that helps patients to pay health insurance premium, monthly health insurance premiums for secondary and primary insurance. And then finally, we have the Transportation Assistance Program, which helps patients to cover the cost of approved transportation, lodging, and other travel expenses incurred from the patient's treatment visit. All our assistance program does come in the form of financial grants. And later this fall, PAN will launch a travel and transportation assistance program to better serve a new program to better serve our grant recipients for their travels to their treatment, so stay tuned. A common question that we get at PAN often is what we cover and what we don't cover. So at PAN, we cover products that are FDA approved and listed on official compendia or evidence-based guidelines for a specific disease fund. So this includes brand medication. We cover generics, bioequivalent or biostimulant medications, as well as specialty and radiopharmaceuticals. Very few disease funds that we have also cover medical supplies for administering treatment, such as our Parkinson's disease fund. So now that you know what we do cover, it's also important for us to talk about what we don't cover, as we often get claims for services that we don't cover. So at PAN, we don't cover any product that is covered at 100% by the patient's insurance. Believe it or not, we've gotten claims like that. We also don't cover any product that the insurance did not cover at all. Because we are a payer of last resort, we want to make sure the insurance has covered the product, and then we pick up the patient responsibility in a form of copay, coinsurance, or deductible. We also don't cover doctor's visit, lab work, genetic test, or ER hospital visits, etc., as well as any medication that is not on our formulary. But there is an exception to this rule. So if a medication is indicated for a disease state, however, you don't see it listed on our formulary for a disease fund on our website, please reach out to us. You can either go on our website at panfoundation.org, or you can give us a call, and we'll be able to assist you to see, and we'll review it actually to make sure that that particular medication should be covered. And in about 7 days or so, we should be able to get back to you to let you know if we'll be able to cover it under that disease fund. So that is an option that is available to you. And we always like to let our patients know in case that they have a medication or taken a medication that is not on our list of formularies. So PAN provides financial assistance for over 70 disease funds, and they all range from chronic to rare to oncology diseases. Recently, we added pancreatic cancer and bipolar disorder to our list of disease funds, and we launched the COVID-19 Financial Assistance Support Fund to support those affected by these uncertain times. So the COVID-19 Disease Fund is unlike any of our other assistance programs in that it covers a range of services, including over-the-counter and prescription medications, medical supplies and equipment. We also cover transportation to medical or pharmacy appointments, as well as groceries and meals, including deliveries. Specifically, and more of the reason why we're here, for Fabry disease, we have 3 assistance programs that covers the first one is the Fabry disease medication or copay assistance program, which assists patients with $7,800 a year. Now, we make sure throughout the year that our grants provide enough financial assistance for our patients. So we're always reviewing, taking the average number of claims that we get to make sure that we are providing enough funding for the patient for a specific disease fund. However, we do know that there are some patients that are outliers, and so they do have a little higher out-of-pockets. So at PAN, if you run out of funding, say your eligibility period is from January to December, and sometime in November you run out of funding, if the disease fund is open, you can apply for something that we call second grant, and we'll be able to provide you another $7,800 to be able to carry you through the end of your eligibility period, which would be December 31st. So that's something to keep in mind, that we want to make sure that we are assisting and covering all our patients so that they have enough funding to be able to last them for the eligibility period. For the Fabry disease, for their copay assistance program, of course, it assists with copays, deductibles, and co-insurance. Our second assistance that we have for Fabry disease is the premium assistance program. And the assistance amount provided here is the $3,500. Now, I just wanted to let you know that as far as the second grants are concerned, that is applicable on every PAN disease fund that is available. So you can get it for the premium assistance as well. If you run out of funding and the disease fund is open, you can enroll in that as well. And then finally, we have the Fabry disease travel assistance program, which assists with $3,000 a year and covers approved transportation, lodging, and other expenses incurred for your travel visits. To see a full listing and current statuses of our programs, please visit our website at panfoundation.org. So the next few slides, I would like to focus on how to apply for assistance at PAN. So there are 4 easy steps to apply for assistance at PAN. First, you want to check to see if the disease fund is open. Second, you want to verify the program eligibility criteria is met. Third, you want to gather all the required information. And then 4, submit your application to PAN. So let's go ahead and take each step and just delve a little bit deeper into it. So our first step is to check to see if the disease fund is open. There are several ways to do this. You can either go on our website at panfoundation.org, or you can visit one of our self-service portals, either for patients and caregivers, for pharmacies and pharmacy staff, pharmacists and pharmacy staff, or provider for the healthcare provider office. And so you can go on one of these self-service portal and you can check and make sure that a disease fund is open at PAN. Later, I'll provide the addresses to each of these portals. You can also give us a call at 866-316-7263, Monday through Friday from 9 a.m. to 7 p.m. Eastern Time. One other thing that I would like to let you know, so once you go to either one of these places to check to see if a disease fund is open, if you find that that disease fund is actually closed at PAN, what you can do is put yourself on a disease fund wait list. This is something new that we came up with at PAN to be able to help serve our patients better. So the disease fund wait list is the list of patients waiting to apply for assistance for a closed disease fund. So what happened is that if the disease fund is closed at PAN, a patient can sign up for the disease fund wait list, and when the fund opens, we'll send you an email letting you know to go and apply. And we'll provide you 2 days to go and apply for that assistance. And after that 2 days, then PAN takes another 2 days to make a determination to let you know if you've been approved for that assistance. And once we've been able to allocate the funding available to all the patients on our wait list, then we go ahead and open the funding to the general public. So this is why it's a good idea to add yourself to the wait list, because it gives you a first opportunity to apply when funding is available. Our next step is to verify to see if eligibility criteria is met for the disease fund that you're applying for. So for each disease fund, there are specific eligibility criteria. So we encourage you to check this information out on our website to make sure that you have the right criteria for the specific disease fund that you are enrolling in. So this particular one is general for the Fabry disease. So I'll go ahead and let you know what that disease fund is. So for the patient must be getting treatment for the Fabry disease, of course. And this is going to matter when you start enrolling and also when you start submitting claims to PAN. And so we want to make sure that when you're enrolling for a specific disease fund that you do have that disease state. We do have people that, because we have over 70 disease funds, we do have patients that sometimes call us and they're not really sure which disease fund they should enroll in. And so that's the reason why that is one of the criteria that we put up. Second, we want to make sure that the patient resides and receives treatment in the United States, although US citizenship is not a requirement to apply at PAN. The third one is the patient must have health insurance that covers his or her qualifying medication or product. Now, this is specific to the Fabry disease. Of course, they can have any insurance. They could have commercial or Medicare. But for some of our other disease funds, we require that the patient either has Medicare or has commercial. And for a few, the patient can have either or. So it's important to check to make sure which one it is that the one that you're seeking assistance for. Fourth, the patient must be prescribed a medication or product that is listed on PAN's list of covered medication, which we talked about a little bit, that we do have a formulary for each disease fund. So it's important that if you're going to apply for assistance, that you check to make sure your medication is listed on our formulary. And then finally, the patient must have income that falls at or below 500% of the federal poverty level. Now, this particular requirement is for Fabry disease, but for other disease funds is 400, so or 500. So it's always important to check to make sure that you fall within the correct federal poverty guideline. And you can actually check on this information right on the PAN website. There's a calculator that you can plug in your information and be able to check what percentage you fall on the federal poverty guidelines. One additional information I wanted to add to this, for the travel fund, there's a requirement for the patient to travel more than 20 miles one way to receive treatments. However, there is an exception that applies for those living in large metropolitan areas. So if you have any questions along that line, I will be more than happy to assist you. And also our call center is always open to be able to assist you with questions like these as well when you're applying. So this is an actual homepage of our website, and we have tried to make our processes simple and quick for you. And so we've made sure that patients, their caregivers, providers, or pharmacies can check patients' eligibility for a disease fund right on the portal page. Bear with me one second. Thank you. And so we want the patient, the caregiver, provider, or pharmacy can check patients' eligibility for a disease fund and begin application process right on our main page of the PAN website. This is something that we've made sure we put in place so that you don't have to travel too far to be able to get all the information that you need in one place. So from this picture right here, you can see, you can go ahead and type in the disease fund or medication you're looking for assistance for. Then you can put in whether you're a patient, a provider, or pharmacy, and then you'll be able to right away go ahead and start applying for assistance at PAN. And so if you can see, the next step there would be for eligibility, and then you can complete the application. So this is a great tool that we encourage you to use if you need assistance with PAN. Which brings us to our third step, which is to gather all the required information. So if the patient meets all the eligibility criteria listed on the previous slides, you need to gather the following information before you start the application process. Of course, you're going to need the patient's demographic information, such as the name, date of birth, etc. Then you will need the diagnosis and medication name, as well as the insurance information, income information, and physician information. So now you're ready to apply for assistance with PAN. There are three main ways to do this. However, we've talked about the first way, which is going directly on our website, on our homepage, panfoundation.org, and you can start the application process right then. The second way is that you can give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Time at 866-316-7263. Third way is that, and we encourage you to use this way, is to use one of our self-service portals. And we encourage that because almost everything that you can do on our by calling us at PAN, you can do on our portals, either the patient, the pharmacy, or the provider portal. And so for the patient portal, the address is panapply.org. For the provider portal, the address is providerportal.panfoundation.org. And then finally, our pharmacy portal is pharmacyportal.panfoundation.org. And so you can go on the website, you can enroll your patients, you can renew their grant, you can add yourself to the wait list, which is a great thing to be able to do if the disease fund is closed. You can sign up for a second grant if you are out of funding. You can manage your accounts, review eligibility period and grant balance, and so much more can be done on the patient portal. You can even send secure messaging to our portal support team if you have questions about anything from claims to portal support to general inquiry. So it's a great tool, and that's why we say that you can do almost everything that you can do by calling us. You can do it on our portal without even having to call. And once you submit your application to PAN via one of these methods, on average, it takes about 6 minutes to complete this application. And our enrollment decision is instant. So as soon as you finish the application, we'll let you know if you've been approved or not. And so it's very simple for you, and we provide you with all the details that you're going to need to bill us right away. So we'll provide you with the processing information so that you can start submitting claims immediately after you submit your enrollment to PAN. So now that you're enrolled, there are a few things to consider about the PAN grant. So each PAN grant is for 12 months. And if you're new to PAN, what we do is that we provide you with a 3-month look back period. And that is, so if you called us, let's just say today to enroll for assistance, then we'll start you sometime in July to give you 3 months to be able to submit any claims or any expenses you may have incurred during that time before you called us. This is something that we provide to every new patient that come to PAN, or if you're new to a specific disease fund. So let's just say if you had enrolled in the Fabry Premium Assistance Program, but then you now also want to enroll in the Fabry Travel Assistance Program, you will also get this 3-month look back period. Another thing to know about PAN grants is that we do have a grant use policy, which requires that you submit a claim and get a paid claim every 120 days. So on the 90th day, we'll send a letter to you letting you know that we have not received any claims from you or paid any claims in the past 90 days, and that you have 30 days to be able to submit any outstanding claims that you may have. At this point, if you find that you have extenuating circumstances, please give us a call because we will take this into consideration. But if you're not able to call us, and even after, what will happen is that on the 120th day, we will release the funding and make it available to someone else that needs assistance. But even at that time, if you realize that you weren't able to give us a call, however, you had extenuating circumstances that prevented you from submitting your claims, please give us a call. We'll take that into consideration as well. And then finally, You can also renew your grant 1 month before the eligibility period ends. And so if let's just say your eligibility period ends on December 31st, you can start renewing your grant on December 1st. And we like to point this out because, as far as funding is available, it's a first come, first serve. So whenever there is funding, you want to make sure that you go ahead and enroll as soon as possible so that you can secure funding for the next eligibility period or the next year that you have. And so I wanted to just let you know that that is another option that is good and you can use by dealing with PAN. You can renew your grants 1 month ahead of time. So we provide several ways for you to submit your claims to PAN and receive reimbursement. So if you're a pharmacy, the pharmacy can bill PAN on the patient's behalf and will pay the pharmacy directly. If there's a provider's office and the patient went to the provider's office to obtain their medication, the provider's office can also bill us directly and we'll pay the provider's office. Finally, for the patients, PAN can pay the patients directly. And all the patient will have to do is to be able to download a member reimbursement form right from our website under Get Help and then Patient. And they would need to submit a prescription label for services that they received at the pharmacy or an explanation of benefits for services they received at the doctor's office, and we'll be able to go ahead and provide payment to the patient directly. So for premium assistance, it works a little bit differently in that you won't actually have to submit claims to PAN. But what we do is that first, once you enroll with us, we do try to do a call with you just to try to understand what the payment information is, where to mail the claims to, or the payments to monthly, and just gather all the information that we need. So we'll do an initial call with you and the insurance to validate all the premium payment information. Then we'll begin to send payments to the insurance directly each month, or we can also pay the patient directly if the patient now pays out of pocket and then would like PAN to pay them directly. So that is something that we do. You don't really have to submit any claims for it. We just have to confirm that you still have that insurance. So that brings us to the quarterly outreach. And we do that quarterly outreach just to ensure that the patient is they still have that insurance and they're still utilizing it so that we can continue to make that payment. So each quarter, we just require that the patient send us their premium statement so that we can know that they're still using the premium assistance, and also to ensure that the payment amount is still the same so that we can continue to pay. So we understand that managing an illness is difficult, and our patients may need additional support beyond that financial assistance that we can provide them at PAN. They may also have questions about their disease state, treatment, side effect, and medication adherence. They may also benefit from connecting with a compassionate community that can help them deal with the physical and emotional complexities of their disease. So that is why we have formed alliances with the leading advocacy groups, such as the National Kidney Foundation, to name a few, to provide patients with the holistic support that they need. These groups can assist patients with disease-specific education, tools, and resources. They can also provide assistance and support, clinical practice and trial information, and group and one-on-one peer counseling support. All of these resources can be found under Explore Resources page at the PAN Foundation website. We also want you to stay connected with us once you enroll with PAN. And we understand that you have a very busy schedule and there's a lot going on. So we try to make sure that every process that we have is simple and quick for you. And so we are always looking for feedback and any ideas that you give us, we do take that into consideration to see what ways that we can make things simple and quick and easy for you. So one of the ways that PAN has found to try to make things easier for people is the Fund Finder. So the Fund Finder is a free web-based app that can assist patients, providers, and caregivers to be able to assess and access medication on a real-time basis when a disease fund becomes open at any of the 9 charitable copay assistance foundations. And so what happens is that if you go to the website, it's fundfinder.org. So FUNFINDER, I think it's FUNDFINDER, .org. So if you go to fundfinder.org, you can see a list of all the disease funds that are available at all the charitable copay assistance foundations. And you can follow a disease. And what would happen is that when that disease fund becomes available at any of the charitable copay assistance foundation, we'll send you either a text message alert, or we will send you an email to let you know that it is open so you can go ahead and apply for assistance. So anyone can sign up for Fund Finder, and it's completely free. So finally, we know that PAN Foundation is one of many resources to help your patients, and so we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help you. To learn more about PAN Foundation and our programs, you can call us at 866-316-7263, Monday through Friday, 9 a.m. to 7 p.m. Eastern Time. Or you can apply online at panfoundation.org. That's PAN Foundation.org. And you should be able to also find all the links to our portals right on our website under login. So you can also reach me if you have any questions at Quartey, that's AQUARTEY at panfoundation.org. So we look forward to working with you. And again, thank you so much for your time today. I'm really excited that I had a chance to tell you about PAN programs. And I hope that you enroll with us to benefit from all the many different assistance and resources that we have available. So now I will go ahead and turn it back over to Dawn. Thank you so much.
Thank you, Audrey. I saw some good questions for you in the comments. Let me go dig that back up. We had a cat fun and entertainment with cats, so we had a little chat jump there. Sharon asked, if someone is using PSI, can they apply for more assistance on PAN or other groups? So can you be in multiple assistance funds?
That's a great question, actually. So yes, we don't stop our patients from applying for multiple assistance. We just ask that they don't submit the same claim to both parties. But as long as they are using both and they're submitting different claims to us, we're okay with that. So we do understand that some of our patients do apply for assistance with other foundations. So that is not a problem at all. We don't discourage that.
That's great. Yeah, particularly with the travel funds, sometimes, you end up traveling more and needing more, and that's nice that there's 2 options for that. All right, any other questions? But you guys, we're turning the tables a little bit because Audrey has some questions for you. So I'm going to type out a few questions in the chat, and if you can answer them as well. Here we go. Actually, we'll just read. I don't want to type. We'll just read Audrey's questions. You can put the answer in the thing.
Sure.
All right. So the first question was, have you heard about PAN before this presentation? If you could just say yes or no. Oh, bees work too.
Sorry?
Lots of no's. We got a yes, but we got lots of no's.
Okay, well, I hope that you learned something from today's presentation as far as what we do and how to apply for assistance. Then I'm happy to hear that I'm able to, teach new people about PAN. So that's wonderful.
Great. All right, what's our next question? Before you heard about PAN, how were you paying for out-of-pocket costs for medications? Borrowed money, savings, other foundation. You can just do letters. That's too much to type. Just do letters. Let's see what we have. Out of pockets. B, D, C, everything. Everybody's doing everything.
I see.
Savings. Savings is definitely winning though. sadly.
Yes.
Manufacturers copay, there's definitely some of that.
Yes.
More people go to copay manufacturing assistance and PAN, and less people go to savings. That would be good.
Yes, and that's good because these are all resources that are available to help patients. And it's unfortunate that sometimes we don't know about the resources available. So it's good when you do know that manufacturer has assistance available for you, especially, you know, most of it's medication specific, and also that you can go to other foundations also for assistance. And so that's great. That's why the Fund Finder is great, because you can kind of go there and be able to get all the updates from every single foundation assistance that is out there.
We did have one person who has awesome insurance and sometimes PSI. So that's good too. We want that too.
Yes. We just don't
next,
oh, sorry.
No, you're good.
We just don't want people to use their savings, because that shouldn't be. It's unfortunate that sometimes there is not assistance available, but we try our best to make sure all the foundations try their best to make sure that there's funding available so that you won't have to go through your savings to be able to pay for out-of-pocket cost.
Wonderful. All right, next. Have you considered not filling a prescription because you could not afford the out-of-pocket costs associated? So that would be no. Let's see. No. Lots of no's. Oh, there's nay. We got one yes. We got a sometimes. B's are definitely the top answer, but there definitely are a couple sometimes or yeses.
Okay, that's good. That's really wonderful to hear that no one is considering filling their prescription, because unfortunately sometimes when we go out there, we do hear that a lot of people are considering not filling it because of the out-of-pocket cost associated. And let's face it, some of these medications are rather expensive. So sometimes you could understand where the patient is coming from, but it's good when they know resources available to them so they won't have to do that.
Yeah, that's great. Next question. How much do you pay out of pocket per year? A. Not good. We need to get more help. A. Oh, there's a B. A. All right. So it seems like this is a great presentation to help people understand other options for all those people who are doing A or B, some Bs.
Definitely. We just see out-of-pocket costs going up each year. So definitely the more they know and the more assistance available, the better. So
yeah. All right. And then last but not least, what type of insurance do you have? Medicare, commercial insurance for the win. Yeah, lots of commercial insurance.
That's great. That's just really wonderful. And what is good about the Fabry Assistance Program at PAN is that you can have any insurance. So Medicare, Medicaid, you can have Affordable Care Plan, which is also considered under the umbrella of commercial insurance. And so you can have any insurance really and be able to apply for that assistance.
That's great. All right. Well, thank you, Audrey. This has been great to have sort of the interaction, be able to see what people are thinking about, and I appreciate a thorough discussion.
Thank you so much.
Thank you. All right, guys, you've done it. You've made it to the end of our fabulous educational event.